This is UniTalk, the podcast series of the University of Debrecen. We've saved you a seat. In each episode, we'll show you a different aspect of life at UD. Students, professors, and researchers will take you behind the scenes to talk about their life, work, and passion.
Hello, greetings from the University of Debrecen. This is a UniTalk, the podcast series of the University of Debrecen. This is Esther and Dori, the two hosts of today. Today we have a special guest, Dr. Rudolf Kolozsvári, cardiologist and senior lecturer of the University of Debrecen. Rudolf, can you please introduce yourself and tell us who you are and what you do at the clinical center of the university?
Good morning and thank you, Esther and Dori, for the question. As just you mentioned, I am Rudolf Kolozsvári and I am graduated from the University of Debrecen in 2000. After 2000, I started my practice at the Department of Cardiology. And parallel, I was planning and going for the USMLE exams. In 2005, I got accepted to New York Lincoln Medical Mental Health Center as a PGY1 medicine resident. I spent the first year there, and then after the first year, I decided to come back to Hungary and go for the board of cardiology. I successfully passed in 2000, and I became a cardiologist. Since then, I'm doing interventional cardiology and cardiac CT, and I really love doing them. In 2011, I finished my PhD thesis and defended it successfully. Afterwards, I went to Hull, UK for a little upgrade in my interventional skills for 4 months, and then coming back afterwards, I did the interventional cardiology board exam successfully. Since then, I'm doing intervention, I'm doing cardiac CT, I have a lot of patients, and obviously we continued on with the education and the PhD program.
Can you tell a bit more about your career path and what kinds of institutions you went to and why you chose this path, etc.?
Thank you very much for your question. Just like I mentioned, my first aim was to be a cardiologist in Debrecen, but in the meantime, as one of my dreams to work in the US. So for that, I this is why I did the USMLE and went to New York for 1 year. Being there was fun. I learned a lot, but then I just realized that Hungary is my home and still I wanted to be a cardiologist. So this is the reason why I came back. And afterwards, being at home, I realized that I might need some little more of my knowledge, and this is why I decided to go to England. So that was my next step or path in my career, and I really learned a lot in Hull, UK, and it was really fun. So basically, I would say that my base is Debrecen, but once in a while, I had to go abroad to see what I really want to do.
So you have previously studied and worked abroad. Can you tell us a bit of your experience about working abroad? Yes.
What I always say that if you love and like your work and your job, it doesn't matter where you are, you will still be happy. So basically, working in the US, everybody says that it's one of the hardest things to be a resident, especially a medicine resident in the United States. And yes, at the beginning it was not easy, but after a few months I got accustomed with the habits there and how to find the path to what I want to reach. So after a few months it became really, I'm not saying easy, it became acceptable. And the same was true for England. It was a little hard at the beginning, maybe some language issues, maybe some customs that I had to acknowledge there, but at the end it really worked out. And the same stands for Hungary. At the beginning it's never easy, but when you do your job and you know how to do it and you know which way to go in certain circumstances, it becomes fun.
What do you think are the main differences between Hungary and the States or the UK, like academically and like in your normal everyday life? What are the main differences that you can think of now?
Looking back to New York, one of the biggest difference was the quality guarantee system, which means that we were working in groups, 2 PGY1 resident, 1 PGY2 resident, and one attending who was responsible for all of our patients. And at the end of the 4-week rotation, he or she gave us an evaluation of how we work, how we did the physical examination, how we did the history of the patient, how we managed special issues. But on the other hand, we were also asked to give an evaluation of the attending. So it was not a one-way thing. We evaluated our attending and he evaluated us. And that gives a very strong quality guarantee system in the US. I had a very nice attending, and he was very smart, and he taught us a lot. But he mentioned us that a few years ago he was maybe not in the mood, or maybe something was going on in his life, and he taught less than he used to. And the students went to the office and told the program director that he is not teaching as he did before, so we need him to teach more. So they called this attending, and he came back and said, okay, sorry, I will teach more now. So there's a really strong quality guarantee system there, so the students and the residents will get what they want. And then also they have to prove that they are able to work as a doctor. So that, I think, is a big difference. In Hungary, I've never seen any system like that where I can actually complain about my attending that he is not teaching too much or he is not being nice to me. So in the US, they are really, really keen on that. And also in England. In England also it was important that you should be happy with what you do and do it. Not little, not much, a lot. But when you do it, you have to be good, and you have to be happy with what you do. And in that system, they make you feel that.
Okay, coming back to the University of Debrecen, we have over 7,000 international students, and around 2,000 of them study at the Faculty of Medicine. How could you integrate or use your experience or knowledge in your everyday work or in your professional life?
What I really liked especially in the US, but also in UK, that is absolutely problem-based learning. So which means that it's not that you sit down and your tutor or mentor or attending or second year will tell you what is the answer. They want you to reason, and they want you to tell what is the problem with the patient, what is the disease, etiology, medication, etc. So this is what I really liked, and I'm really practicing this. So whenever I have a patient and have students, I always ask them to tell everything what they see. It's not a problem if they say it wrong, just tell me what you see. And then I will try to give them hints towards the solution that I'm waiting for. So it's very important that you have to make them think. Obviously, you need some basic knowledge for that, and that should be given at the classes and the lectures. But when you have that, you have to use your mind and use your brain to figure out what is happening. And that's something that is really, really pushed in the US especially.
So you're trying to implement this to your work here at the university when you have students, right?
Absolutely. And on the other hand, I always, as just I mentioned, the quality guarantee system, I always ask them if they like this method, if they think it's reasonable, if they think we should change on that method. But usually, maybe because they are afraid, I don't know, but usually they say that they enjoy of even it's a little harder than just to get the answers, but they understand why I'm doing that, and they understand that this is the way they will be the most efficient in their work.
Can you tell us something about the international community of the UD? You also have international students?
Yes, I have plenty, also for classes, for lectures, for courses, and obviously for when they come to us for practice, and also when they come to us for research. And what it makes it very interesting that obviously all these people are coming from different cultures, different countries, and along with just discussing the research that we are doing and collecting the data and evaluating it, we talk a lot about their country, our country, their custom. But I always say that when you work with so many, I think we have more than 100 students from more than 100 countries in a university, It's very important that you have to be open for them, because maybe if something is very simple and plain to you, as the way you act, the way you do things, maybe it's different for them, and you have to be open to understand why they put the glass on the right and not why on the left. And that working with in the United States, in the UK, it helped me a lot to be open for these different things. So I really put emphasis on that. We do our work, but on the same side, we put some personal also into this partnership.
What are the plans of the students who graduate at the university? What is the value of the diploma they receive here?
Thank you very much for actually these two questions. Let's talk about them separately. First, many of the students obviously go back to their home countries. That's out of question, because they want to go back and work there. They have their family there, etc. But especially in the recent years, the world is opening up, and ample number of students planning to go to not to their home countries back, but to different other countries in the world to work as a doctor or physician. Obviously, there are some high-yield countries, and that's still United States, United Kingdom, Germany, and for that, they have to do different exams. But what I can see is that actually they do these exams successfully, and that give us a feedback that our education system is not bad. So if in these high-yield countries our students can go there and work after exams, certain exams, it means that what we've done is good and the direction is good.
So basically what they get here is a diploma or degree that they can use anywhere outside of Hungary as well.
Yes, Dori, that is correct. But we always have to talk about two different things. One is the legally accepted diploma, and the second is it a valuable diploma? Because the University of Debrecen diploma of medicine is accepted all over the world. That's out of question. Sometimes you have to do some exams to move on. Licensing exam, exactly. But it's accepted legally. But the other issue is what is behind the diploma. What I always say to my students, or when I go abroad and meet students there, that listen, I'm coming from Debrecen. It's a small town with more than 100 year medical faculty and 400 years of university and education. And with my small little diploma of Debrecen, I did USMLE, I worked in the US, I worked in UK, and was invited to work in different countries, which means that it's not because I'm so smart, it's because that, yes, this diploma that you earn in the University of Debrecen is a valuable thing, not just legally, but what they see that the Hungarian doctors, and this is what I hear and what I experience, when they go abroad, they know where they work, the acceptance side that they can rely on these doctors and they will do a good job. So what I can also again say, I was an average student, but I worked in the US, UK, I did my PhD here, so I think that proves that yes, the diploma is something to be happy with.
Yeah, and just to make it clear to those of you who might not be aware, as we mentioned, the University of Debrecen diplomas and degrees are worldwide recognized, but that does not mean that you don't have to take a licensing exam if you would like to work abroad. It happens with every country, even American citizens. They have to take the USMLE if they wish to continue on and be practicing doctors. So most countries have some type of licensing exam. And so the university is trying to help students pass these exams successfully. So I think that's a great extra that you get along with your general education as a medical doctor.
Absolutely. And what you mentioned is that to have the exam successfully completed, it's not enough, because in the US especially, it's mandatory to pass it for the first. If you don't pass it, your chances are very low. But it's not just that you pass for the first, but you get a very good grade on the exam. And this is what these courses offer. They tell you what is needed for the exam. They teach you how to manage your time, and they really focus on those issues, subject that will be asked in the in the exam. It's my experience. I had no option to go for this course because they did not provide it in Debrecen, and also I didn't have money or time to travel to the US for the course. So I did my USMLE exams actually by my own. And many years afterwards, when I was organizing this USMLE preparatory course, I was sitting for 1 or 2 lectures. I was really want to see what is happening. Why is it so famous? And actually, when I was listening to the lecture, I saw the questions in front of me that I had in the exam. So I was kind of rehearsing those exam questions. So they really know what they will ask in the exam. And they really teach you. For example, biochemistry, 2,500 pages. And then I was studying, obviously it's too much, along with all the other subjects. And then I realized that you need 150 pages. But that you have to know very well. The rest is not needed for the exam. I didn't know that before. So this is why it's really important for these students to go for these preparatory courses, because they get to know what is needed, how it's needed. They practice a lot for the tests.
There's a mock exam as well, right?
Absolutely. There is a mock exam at the beginning and at the end. So they know where they start from and they know what they reach in 7 weeks. With regards to the passing rate, for example, USMLE, university, our students have a very good passing rate. And this is partially or mainly due to the mock exams, actually, because this is where we evaluate them. And we can, and the company can give them advice whether they should approach the exam now or maybe they should study a little more and approach it later. Again, this is a kind of like I mentioned before, a different subject. It's a quality assurance system that we want them to pass for the first, and we want them to have the best grade that they can have. So this is why we have all these mock exams. So we can give them advice and they see if there's any weakness in their knowledge or time management, etc. We really put high emphasis on that. It's for their benefit mostly.
And I also heard that UD students, when they want to do these preparatory courses for the licensing exam, they get discounts so they can reach their goals more easily.
It's absolutely correct. Yes, we give discounts for those students who have good grades from the price of the course. And actually, this is kind of a motivation for the students, obviously first because it's going to be cheaper, but secondly because they will do much better on the actual exam if they have good grades, because that tells us that yes, for the past 1 or 2 years they were putting energy into studying and learning more and more. So that kind of in first place support and make them study more in the university, and secondly, if they do that, they will get a discount, and along with studying more, probably they will get better grades on the exam.
As someone who's experienced living and studying abroad and working abroad, and someone who's gone through this whole experience, what advice would you give to future students wanting to study abroad and wanting to come to Hungary to finish their education?
Yes, thank you very much for the question. And I practice this every year, every day, because when I see students abroad, they always ask me why should they come to Debrecen and why not some other places. And first of all, Debrecen has a history of 400 years of education. So it's kind of, we know and we try to know what we are doing. The education in medicine is approximately 100 years old. So we are not newcomers. We are not a university founded 10 years ago who are trying to find their way in life. Secondly, we have an open society here. We have students from more than 100 countries. So if students from all over the world coming to Debrecen, it must be a nice place to study and to live. Also, coming back to the University of Debrecen and mostly Debrecen, like I said, it's a small little town, it's quiet, but on the other hand, we have airport, we have everything on the campus, because in different universities, It's not better or worse, but in different universities, sometimes you have to travel a lot between the departments. And in Debrecen, 99% of the facilities are on one campus, which means along with dormitories, departments, theoretical departments, clinical departments, everything is on one campus, which actually resides in a forest, Great Forest of Debrecen. So what I always tell my students, if you come here for 6 years, actually you don't even have to move out of the campus because you have all the facilities that you need in Debrecen. Many years they had to travel to Budapest if they wanted to fly home, but for the last few years we have an international airport in Debrecen, and we have more and more destinations to the world. But if they decide that they would like to travel somewhere else, it's a 2-hour ride to the capital of Hungary, Budapest, where they find another international airport flying to almost all destinations in the world. So what I say to the students, that you come here on the 1st of September, and after 6 years, you leave Debrecen with a high yield and a good value diploma in your hand, and your parents don't have to worry about you because you don't have to travel over the country to find what you need, and you can just have a very nice, quiet life in Debrecen for
focusing on your studies.
Yes, absolutely, because it's very important that you need a good and quiet place for the 6 years, because the medicine to get the medicine diploma is not easy. Obviously, other diplomas aren't easy to get also, but there are some really hard times, especially the first few years, and you really need an organized environment to be able to focus on your studies.
You mentioned that there are research options at the University of Debrecen. Are students allowed to join these programs? How does it happen? Absolutely.
Both pre- and postgraduate, the students can join our research, and actually pre-graduate, at the end, they provide a lecture on that. And actually these lectures are evaluated and they get grade for that. So it's a really good experience for them, how to do research, how to collect data, how to evaluate the data, how to prepare a presentation, how to prepare an article on that or documents. So they really enjoy being a part of a, we can say, serious research what we do in the University of Debrecen. And on the other hand, when they graduate, they have an option actually to follow up their research and studies with PhD thesis. So in that sense, if they decide not to go back to their home country, but they would like to carry on their research or find a new research area, they can actually do that in our university. And that will provide them, just like the diploma, and internationally accepted PhD diploma.
It's great to hear that there are so many options for international students, international medicine students at the University of Debrecen, and that they can join research programs or go on with their licensing exams, and they have a degree in hand that they can use all over the world. So I think today's session was really useful, and we thank you for your great answers.
Thank you so much for sharing your experience with us.
And we wish you good luck for your future career, and hope to see you soon.
Dear Esther and Dori, thank you very much for the opportunity of talking about this very important topic. For those students who wish to come to Debrecen, on behalf of the faculty, I can promise that we will do our best to help you for reaching your final goals in your career.
In case you are interested in our medical degree programs, please visit our website edu.unidep.hu to have more information about the programs and apply until the 31st of May 2022.
Or write us on any of our social media platforms. We are happy to answer.
Thank you. Goodbye.
Goodbye for now.
Thank you. Bye. Thank you. Bye.